Good morning. How is everybody doing today? Yes, this is Mr. Procrastination. Hadn't put out a podcast in quite a while. My fault, because that's just how I am sometimes. So, today is Little Friday, or Thursday, we call it, but I like to call it Little Friday. Last weekend before we start back into Med Surg 2. And I will say we've had 2 weeks off in between the semesters. Mama Baby is behind us, and I'm so glad, because out of my wheelhouse on that one there. But I'm so proud. We all did very well. Kudos to Mrs. Pohl. She was is and always will be a fabulous instructor, but we all pulled together. She pulled together. We got it. I made the grade I needed. Didn't do good on the second test. Wasn't in the right mindset. But you know what? I turned it around. And a lot of people did too. So proud to everybody. So go ahead and enjoy this last weekend, because I know I am. I'm not working. I got to go in a couple hours at the hospital and a little bit on Friday night. That I am off. Going to enjoy my time, maybe do a little work on my daughter's rental. And then Saturday night, going to go to a friend of mine, good friend of mine. Got her paramedic patch. Had to go to class twice, but you know what? She stuck it out, and she got it done. I'm very proud of her. So her husband's putting on a big old party. Drinks, food, everything supplied for. So why not? As we say in EMS, free is for me. So with that being said, what to talk about, what to catch up on. So, I've had a lot of thoughts going through my head about what to talk about, and they're going to be random thoughts today. Excuse me there, I got my morning coffee, third cup to go. So, if you hear me drinking, that's what I got going on. So, first thing to talk about. I like the old saying, if you don't use it, you lose it. So, I was going through my paperworks. I like to clear my desk between each new class. Put things away, throw things away I don't need. I don't keep paperwork. We get everything on digital file that I got, tucked away, that we work on. And I started thinking, I came across our ABGs. Is it acidosis, alkalosis? I can never say that word correctly. Is it acid? Is it a base? Is it respiratory? Is it metabolic? And I go back and started thinking, I do have a little rhythm that I picked up from simple nursing, and that helped me get the correct answers on tests when it came to that. So I started here thinking that, you know what? I kind of forgot how to do that because haven't used it. And I tell you, this is me. A bad trait that I have when it comes to schooling or education while in a structured setting that you have to make a certain grade on the test used to be I would learn it, use it, and then dump it. Next subject. So you can't do that in nursing. But you think again, you can't retain everything in nursing, as I know that you cannot retain everything in EMS. I've been in EMS since 2008. Some things do come back to me a little slower if I'm doing some critical thinking, on a call, or have to do some special skills while I'm back at the truck. But that's why we practice. But it's amazing in nursing. There's so much. I watch these nurses. I work at Park Ridge, and I watch them. We get busy, and I try to help them. My biggest thing, I like to pass meds. That's my biggest contribute to them, while they may be doing something with that's a little more intense with the patient the doctor's asked for. So it's made me really start to think, how am I going to keep up with my skills? How am I going to keep up with nursing skills and things of the nature there? And so my biggest thing is going to have to practice. And that's a good question. Where are you going to learn at? Like with EMS, we always have a training room. We have mannequins. We have IV arms. We have mannequin heads to do intubations, to practice putting in OPAs, MPAs in the mouth, in the nose. Practice using a BVM. Practice this, practice that. We do things of that nature there. We have I don't know if we're going to be getting into cardiac on this next go around or not. I like cardiac. That's something I always have to review. Going down a rabbit hole here, I always have to review cardiac. That's something that I really had to work very hard at in school to learn. But anyway, we have a thing that's called a rhythm generator. So we can take our cardiac monitor and we can hook it up to this little box that's got batteries and produce almost always the main rhythms. So you got lethal rhythms, regular rhythms, bradycardia, tachycardia, sinus tach, things of that nature there. And you can do rhythm checks, on the monitor. You can look, you can test yourself and say, okay, I know what that rhythm is. Okay, how are you going to treat that rhythm? I'm going to do this. I'm going to go down A, B, and C. So a good question to ask is, I know when you're going to go, if you have worked in hospitals long enough, and some of y'all have, you do go through these, I can never say this word correctly, these competency skills, where basically you have, it's by law, by JACO, if I think if it's by JACO, but once a year, you have to have training in these just certain skill sets of where you work in the hospital. And a lot of it is how do we use a wheelchair, how to use a Hoyer lift. A lot of it is BGL checks. So they check you up on these small skills of what to do on that nature there for your job wise. But I don't never really seen like a true training room for nurses, to practice on things. Do they have an IV arm? So that's a good question to ask. Whenever you're going to be working at, or you're going to start interviewing, or I'm sure a lot of us I've been hearing talking class, we think, well, maybe I want to work for Piedmont. Well, maybe I want to work for MUSC. And some people, I don't even want to work for neither. I want to do something, different. And that's all fine and dandy. But it's a good question to ask if you're going to be in a bedside place is, do we have places to practice skills? And so, and then from time to time, you can go back, do a little practice on them, maybe things you need some work on, and to work on. So the old saying is, if you don't use it, you lose it. So with us, it's more on, knowledge that we have obtained and that we build upon each. Each class gets a little harder and they give us more knowledge based, stacked on top of what we already know. So with that being said, what am I trying to say? What I'm trying to say is this, is get the cheat sheets out, get the study notes. Within my little notebook, and I have my drug calcs. I have my conversion charts from ounces to mLs, grams to mLs, back and forth. The small things that can trip us up on a test. ABGs. I'm going to be working on that probably this week, and I don't have my little cheat sheet, but I know where to go and print it out of what works for me. So with that being said, I want to encourage you, let's get your notebooks dusted off. Let's get ready to work on this this last class, and we will be done, I believe, at the end of July. Pinning ceremony, I believe, is going to be August 9th, and we're going to move on. Some of us are going to be starting at the end of August into the ADM program. Some of us are going to kind of hold tight, and some of y'all are going to be like me. I've already signed up for my college algebra and for my micro at York. So I'm going to be doing college algebra first, 8 weeks. Then the second 8 weeks, I'll be doing micro post hip surgery. So that's another thing to talk about. But I haven't that done on the 27th. But I'm getting myself ready for next year. If I go back to York, it'll be in August. And if I get picked up at Piedmont College in Greenwood County here in South Carolina, that will be starting in May. So I'll keep you posted on that. All right, enough of that rambling on. Let's finish off strong. So another thing I want to bring up is this. And this can be a funny topic, but here's the thing. With on the job site, in life, in manner, with your family, especially with our family. Our family can be pretty funny, brutal. And I hate to say the word brutal, but we always said we are our children's peer pressure. 5 kids. We've always been one to kind of rib, make a little fun of. They make fun of each other. Sometimes people cry. Sometimes the siblings cry. Then we push it a little too much, but that's family and such. And I noticed today, I never wanted to be one of those people of, well, back in my day or back in the old Coast Guard. And, and where I'm getting with this kind of conversation is, I'm going to be straight up with y'all. Don't be a snowflake. Don't be a snowflake. You're going to be working jobs where you may get a little hazing. Now, hazing is not smiled upon these days. I come from a military background, and when I got into the Coast Guard, there was no hazing in boot camp. Boot camp's boot camp. You just something you do, you get through it. I went to my first duty ship, and we used to call it. You had the old guard and the new guard, and I was in the Coast Guard, and I was on the tail end of the old guard, like retiring. So with that being said, I had my fair share of hazing. Now, I wasn't beat up. I wasn't held down on my. If you ever watched the movie Full Metal Jacket, where the real slow guy, he was held down with a blanket, and everybody took soap wrapped in the towel, beat the snot out of him. That never happened to me and such. But I do know that has happened in the past of other the Army, Marines, things. Maybe I don't really condone that, but I think there could be some healthy hazing. That's the word I like to use, healthy hazing. I had that. Very blessed with myself that I always had a big stature about myself. I mean, I'm big now. I don't say, 10 years ago with me, 80 pounds ago, I was, really fit. No one really messed with me on that aspect as far as wanting to rough me up a little bit, wrestle around, being the new guy, because they kind of steered clear to that. But I tell you one thing, I got all the crappy jobs. And I mean, I got them all for being the new guy. And so with that being said, I don't know how it is really in the hospital setting. I'm sure you don't have things of that nature there. But just be ready. You may have, you may be given the crap patients. You may be being the new person, maybe pushed a little bit in your skills, pushed a little bit to see where you at there. There are a lot of the old nurses are retiring out, and I'm not saying that you need to be run over and all that, but I always say a little healthy hazing can be good. So, and now if they're like insulting your beliefs, please hear me out. I'm not saying that right there. That's wrong. I do not condone that. That's just completely wrong, and it's not right. There, that aspect. But, if it's going to be coming down to where you have to maybe, do some extra jobs because you're the new person and things like that, you know what? Roll with the punches. Don't be a snowflake. Do your thing. Do your job correctly. Do it good. Do the best of your ability that you out there. Because sometimes healthy hazing just shows you that, they like you. They like you a lot there. And so, and a lot of times that could be a good thing. A little bit of that going on. Some of y'all may not agree with me on that, and I'm sure a lot of people has had bad experiences, as so have I. When I got in the EMS, my first 911 service was Lexington County, and very, very fond memories starting off there. And I worked with a lot of medics that were part of that old EMS, and I walked in, and usually when I started off with Lexington back then, got a check off sheet, got to check the truck off. Well, I was just a basic, and then I worked with a paramedic. Well, I had my side of the check off. It was the basic side. Then you had an ALS or an advanced life-saving side of the checkoff list, and that's a little more in detail of the medications, the the devices we may use, the innovation kits with the tubes and the handles. Do I have all what I need in for that? And then he did his side of the check off. Well, guess what? Didn't happen. I had to do the entire check off with a lot of the medics. And technically by the book, I could have said, no, I'm not doing it because that is not my side of the check off there. But you know what? I kept my mouth shut. And I spent hours in the back of that truck checking off both sides. And you know what it did? It made me a better EMT. It made me a better provider. It made me, if anything, a better partner to my medic, who may be having multiple patients, multiple ALS patients, advanced life-saving care patients, and maybe I was not where I can do those skills, but if anything, you know how many times I've gotten in the back and have everything set up for my medic when I was newly starting out, because you know why? I knew where everything was. I knew my medics. I knew what they were thinking. Or I would ask, what would you like to have ready? And they would tell me. I would get in the back. I would open up the immunization kit. I would have the IVs set up, open up, ready to go on the bench. So when they rolled in, that medic can grab what he wanted and get it done. And why was that? Was because even though I had a little hazing, a little healthy hazing on those checkoffs, saying you're going to do it all, while they sat inside and had coffee and and took it easy with the firemen the first half of the shift there. So with that being said, just take it day by day. Healthy hazing can be very good. It can bring unity. It can bring camaraderie. I don't know a lot about it. I'm just speaking more on the EMS side of things right here. I'm very blessed at one of the counties I work at. We got good EMTs. I got great partners. They got thick skin. And because they've been in it for quite a while. We're not mean. We're not nasty to new people. But sometimes we want to see where they sit at in life. Where are your skills? And we teach them. We work with them there. We may give them some extra things to do that needs to be done. And that may happen to you. And guess what? It may even happen to me. 53 years old doesn't mean, age doesn't mean nothing. So with that being said, don't get butthurt. Don't be a Nancy. Don't be a Karen. Unless they really just being mean and derogative, then guess what? Yeah, you got to speak up. And I would never, ever do that to no one, at least on the EMS side, with that. Because we all have to work together one way or another. So with that being said, just roll with the punches. Do it with a smile. Learn your job whenever you get going, wherever you're going to be starting at. And just be a great provider. Never stop learning. Now I'm going down a rabbit hole. Maybe for my last little thought or tidbit out of my head is the other day I was working Park Ridge. I came in around 11. I did a partial shift. Came in at 11, left at 8, left at 7. So always go to the charge nurse, And so I sat there, watching her, and she had her book out, and I could tell she was studying something. So, we're just making small talk. Things weren't that busy at that moment. And I said, what are you studying there? What do you got going on? And she's like, well, I'm studying for my critical care nurse. Or I'll call it the alphabet. You ever notice, you look at the name badges, everyone's got alphabets behind their letters, their PALS, ACLS, or this, or that. I don't know all the nursing ones, but she was studying for her, I think it was for her trauma certifications, in which I will be doing one day myself. As soon as I can get the basics down and feel comfortable with my basic skills, then I'm going to move on and work on further educating myself. So with that being said, it's good to see, people to move on to get these certifications. Some may do it for money. Sometimes a lot of places where, I got this certification, they may give you a little bump up in pay. That's a good incentive. And with me, I'm all about the greenbacks. I'm all about the greenbacks. So, but also I'm all about good patient care. I'm all about how can I progress my knowledge to see something comes up. Because My brain works a little different coming from EMS. There's days I'll be working in the ER and I might be just stocking gloves. Things are slow in my area. I may be doing supply checks, pulling linen bags out, just basic mundane work. But you know what? You never know when that day is going to come where you're going to be, or your facility may be the overflow of massive trauma. And we're not a trauma one hospital. I don't know what our level is, but let's say the one downtown, which ours is Prisma Richland, downtown Columbia. What if that gets overran? Well, they use other hospitals as overflow to triage, maybe not the most critical, but semi-critical patients out. That might be, I know, that would be our hospital. But you never know what's going to happen. You never know what accident. I don't live, in fear of that nature there, but I also live in preparedness. So with that all being said, preparing for your supplies, but also yourself. Are you prepared? Preparing yourself mentally, preparing yourself in medical knowledge. Are you constantly studying, or not even constantly, but just always have your head in the book, reviewing something. And so it was good seeing this nurse here, working towards that. Some want it and some don't. I'm not that versed in the world of people studying or what's the vibe out there today. And so, but always remember to keep your head in the books. Always, if it's listening to a podcast or something of that nature there in the morning of maybe a subject that you like, or maybe something that you're a little weak in, that you can just follow up. YouTube, great resource. No excuse for not knowing something or furthering your education than YouTube. So, I have rambled off enough. My coffee's getting cold. I need a little refill here. So let's remember the 3 things for this morning. Let's finish strong. Don't be a snowflake. And keep your head in the books. I will see y'all Monday at the York campus. And let's knock this thing out.